Dear students, this is Kim's Khanak Institute of Medical Science, Patna. Here's we know about diabetes, a comprehensive overview. Introduction to diabetes. Diabetes mellitus, commonly referred to as diabetes, is a chronic metabolic disorder characterized by elevated levels of glucose, sugar, in the blood. It results from a deficiency in insulin production, its action, or both. Insulin is a hormone produced by the pancreas that regulates blood glucose levels and facilitates its uptake by cells for energy production. Types of diabetes. 1. Type 1 diabetes, T1DM. Cause. T1DM is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This leads to an absolute deficiency of insulin. Pathophysiology. The lack of insulin causes glucose to accumulate in the bloodstream, while cells are starved for energy. Patients with T1DM require lifelong insulin replacement therapy. Clinical presentation. T1DM usually manifests in childhood or adolescence with symptoms like excessive thirst, polydipsia, frequent urination, polyuria, weight loss, and fatigue. 2. Type 2 diabetes, T2DM. Cause. T2DM is primarily a result of insulin resistance, where cells do not respond effectively to insulin. Over time, the pancreas cannot produce enough insulin to maintain normal blood glucose levels. Pathophysiology. Insulin resistance leads to impaired glucose uptake by cells, causing elevated blood sugar levels. It is often accompanied by obesity and lifestyle factors. Clinical presentation. T2DM is more common in adults and is often asymptomatic in the early stages. Symptoms may include increased thirst, frequent urination, fatigue, and slow wound healing. 3. Gestational diabetes mellitus, GDM. Cause. GDM occurs during pregnancy due to hormonal changes that can lead to insulin resistance. Pathophysiology. Hormones from the placenta can interfere with insulin action, leading to elevated blood glucose levels. Clinical presentation. GDM may not cause noticeable symptoms but can lead to complications for both the mother and the baby if not managed. Causes and risk factors. Genetic factors. Both T1DM and T2DM have a genetic component, meaning a family history of diabetes can increase the risk. Obesity. Excess weight, especially abdominal obesity, is a significant risk factor for T2DM. Lifestyle. Sedentary lifestyle and poor dietary choices contribute to the development of T2DM. Age. The risk of T2DM increases with age, especially after 45. Gestational factors. A history of gestational diabetes, or giving birth to a baby weighing over 9 pounds, increases the risk of T2DM. Ethnicity. Certain ethnic groups, such as African Americans, Hispanics, and Asians, are at a higher risk of developing diabetes. Pathophysiology. Insulin deficiency. In T1DM, the immune system attacks and destroys beta cells in the pancreas, leading to an absolute insulin deficiency. Insulin resistance. In T2DM, cells become resistant to the effects of insulin, leading to impaired glucose uptake. Glucagon imbalance. In diabetes, there is often an imbalance between insulin and glucagon, a hormone that raises blood sugar, further contributing to hyperglycemia. Hyperglycemia. Elevated blood glucose levels can damage blood vessels, nerves, and organs over time, leading to various complications. Clinical presentation. Polyuria. Excess glucose in the blood causes the kidneys to work harder, leading to increased urination. Polydipsia. Dehydration due to polyuria triggers excessive thirst. Polyphagia. Cells are starved of glucose, leading to increased hunger. Weight loss. Tissue breakdown occurs as the body seeks alternative energy sources. Blurred vision. High blood sugar can cause changes in the lens, leading to vision problems. Diagnosis. Fasting plasma glucose, FPG, test. Measures blood glucose after an overnight fast. A fasting glucose level of 126 mg/dl, 7.0 mmol/L, or higher on 2 separate occasions indicates diabetes. Oral glucose tolerance test, OGTT. Measures glucose levels 2 hours after consuming a glucose-rich drink. A 2-hour value of 200 mg/dl, 11.1 mmol/L, or higher confirms diabetes. Hemoglobin A1C, B1C, test. Provides an average blood glucose level over the past 2 to 3 months. An B1C level of 6.5% or higher indicates diabetes. Management and treatment. Lifestyle modifications. Weight loss, a balanced diet, regular exercise, and stress management are crucial for managing diabetes. Oral medications. For T2DM, oral anti-diabetic medications help improve insulin sensitivity, stimulate insulin release, or decrease glucose production by the liver. Insulin therapy. Essential for T1DM and often required in advanced T2DM cases when oral medications are insufficient. Continuous glucose monitoring, CGM. Provides real-time glucose readings, helping patients make informed decisions about diet and medication. Insulin pumps. Deliver a continuous supply of insulin, closely mimicking the body's natural secretion. Bariatric surgery. Considered for severely obese individuals with T2DM, as it can lead to remission of the condition. Recent research and developments. Artificial pancreas. An advanced system combining insulin pumps and CGM for automated blood glucose management. Stem cell therapy. Exploring the potential of using stem cells to regenerate beta cells and restore insulin production. Precision medicine. Tailoring diabetes treatment based on an individual's genetic makeup and response to therapy. Targeted therapies. Developing medications that target specific molecular pathways involved in diabetes development. Immunotherapy. Investigating ways to modulate the immune response to prevent destruction of beta cells in T1DM. In conclusion, diabetes is a complex metabolic disorder that requires a comprehensive approach to management. With the right interventions, lifestyle changes, and advancements in medical technology, individuals with diabetes can lead healthier lives while minimizing the risk of complications. Ongoing research continues to unveil new insights and treatment strategies for this prevalent condition. All these information are collected by Dr. Sandeep. He is founder of KIMS, Khanak Institute of Medical Science, an institution of paramedical course like radiology, medical lab, technology, physiotherapy and many more. You can build your career in paramedical sectors with KIMS, Khanak Institute of Medical Science. KIMS, Khanak Institute of Medical Science is located at Ashok Market, Main Road, New Jaganpura, Patna 8,27,000. Mobile number 8710215007. Visit us on also www.kimspatna.com. Join us. Thank you. We don't just sit around and wait for other people. KIMS Patna.